Sutherland, naturopath and FX Medicine Ambassador. We are here today at the 2024 NHAA Herbal Medicine Summit. With me is the lovely Dr. Leslie Braun. Hi, Leslie.
Hey Emma, how are you?
I am excellent, excellent, excellent. Now, I would love to know what kind of research is getting you up in the morning these days? What are you interested in and what are we learning?
One of the things that I've been really excited about in the last couple of years was I like to tackle a really big problem. And one of the things that I've realised, as I'm sure many people have, is that, for example, folic acid, really important when women are looking to become pregnant, when they are pregnant, to reduce neural tube defects. And in my mind, I thought, surely the answer can't stop there. There must be something else out there. It can't just be one thing. There must be other things. So I guess the last couple of years has been a search to find what that thing is. And I believe we found it. But as you would know, research in pregnancy is very, very difficult. So the first thing we needed to do was to create a new methodology called an integrative review, which is looking at test tube models, animal models, randomised trials, population studies, put it all together to give you a landscape of the evidence and then throw a hypothesis at it. So we worked with the University of Indonesia and Oxford University, actually, to create this model, and I put the hypothesis up against that, and they worked on it for a couple of years, and we got the answer. And do you want to guess what this ingredient is?
I have no idea, but I am so curious. What is it?
Okay, it's vitamin B3. Now, why B3? B3 is a DNA stabiliser. And if you think about it, vitamin B3 is really important when it comes to things like longevity, in terms of cancer prevention, but also if you're looking at the growing fetus, DNA stabilisation is really, really important at that time when there's a lot of cell division going on. And so there'd been some early work done with rat models actually in Australia at the Victor Chang Heart Research Institute, giving little rats lots of B3, and they found that their little babies didn't have any of these heart malformations. That's where we got the idea that maybe B3 could be something in adults as well. So that got accepted as a poster presentation last year at one of the big International Nutrition Society conferences, and now it's a matter of getting the full-length paper published in a peer-reviewed journal.
That's incredible. So what kind of time frame until we've got some definitive clinical guidelines in relation to that?
I hate to say, but it could be years. I mean, even when you look at the folic acid research, it was done in the 70s. And even today, so many years later, there's still quite a lot of women who aren't aware of the importance of folic acid. I'd like to believe that now people are becoming more aware, particularly in terms of self-care. So the first thing is to try and get the paper published, but then there'll be groups out there that say, well, now we need the randomised trial. The problem's going to be, where can you do a randomised trial like this? Which ethics committee will let you do that? We don't know. So in my mind, B3, it's an Austell, it's available over the counter, it's super safe. Why wouldn't you? You know, benefit risk, no risk pretty much, and potential high benefit. So if we can get it published, do some education around it, hopefully more people will learn about it.
And most preconception and pregnancy formulas have some level of B3 in them, which is also great to see. So that's wonderful. But the future research is just so fascinating. Is there anything else that you are also passionate about? You've always got so many different things going on, but in the space of research, anything else that's coming up for you?
There's two different things coming up, yes. One of them is we're about to start a randomised trial actually in China, looking at a particular combination, and we're comparing it to placebo for visual contrast. So I guess it's like making the invisible visible. So, you know, when you're driving your car at dusk and it's really hard to see the road, or you're in a restaurant with dim lighting, it's really hard to see the menu, that's visual contrast problem. So how can we sharpen that up? And as it turns out, these ingredients are really good for cognitive health as well. So that's a study that's going to start hopefully next year. But the other thing I'm finding really interesting is real-world evidence. You know, if you think about it, there's all of these studies that happen pre-launch so that you can substantiate a claim. But what about those thousands of people that are using supplements post-launch? I mean, how many hundreds of thousands of people have used fish oil, for example, or glucosamine, or any of these really common ingredients? And there's a wealth of data out there that we could be mining to really understand more about these ingredients, not just what the claim is on the label, but I know other people will be getting other experiences, and how do we capture that?
Would you be thinking about employing AI in order to help gather that data?
Yeah, look, AI is a great enabling tool to be able to crunch a lot of data really quickly and to help look for the patterns. So it's an enabler for sure, but you've got to put up a hypothesis. You've got to kind of throw the tool at the target and you've got to work out what those targets are. And I just think it's going to open up a whole range of new possibilities for us.
Well, thank you so much for joining us today. Don't forget to join us on our socials and head to the website for all the incredible information we have for you there.